Welcome to our take-home points on cardiovascular physiology number 2. Let's go. Take-home point 1. What are the two formulas for mean arterial pressure? One is MAP equals cardiac output times total peripheral resistance. And the other one is MAP equals 2/3 diastolic blood pressure plus 1/3 systolic blood pressure. THP2. Why does diastolic blood pressure contribute more to mean arterial pressure than systolic? Because the heart spends more time in diastole. THP3. What is pulse pressure and what's affects it? Pulse pressure equals systolic blood pressure minus diastolic blood pressure. It's going to increase with increased stroke volume or decrease arterial compliance. THP4. What causes a widened pulse pressure? Hyperthyroidism, exercise, increased stroke volume, aging, atherosclerosis, that not necessarily increase stroke volume but decreases compliance. So in this case here, this increased pulse pressure, this widened pulse pressure does not represent increased stroke volume necessarily. THP5. Where is pulse pressure lost in circulation? Past the arterioles. Only MAP persists in capillaries. So when they reach the capillaries, only MAP. THP6. What four factors increase myocardial oxygen demand? Contractility increases myocardial oxygen demand, increase afterload, increase heart rate, and increase wall tension. THP7. How does Laplace's law relate to wall stress? Wall tension, wall stress equals pressure times radius in the numerator divided by 2 times wall thickness. THP8. Why does hypertrophy decrease wall tension? Because it increases wall thickness, which is in the denominator of the equation. THP9. Where's the most deoxygenated blood in the body? In the coronary sinus. THP10. What happens to wall tension in a dilated heart? Tension increases due to increase radius and decrease thickness. THP11. How does the cardiac function curve shifts with increased contractility? Up and to the left. Talking about Guyton curve. THP12. What causes the vascular function curve to shift right? Increase blood volume or increase venous tone. THP13. What is the operating point of the heart on a Guyton curve? Where cardiac output equals venous return. THP14. What is the biggest determinant of resistance? The radius of the vessel to the 4th power. Remember. THP15. What happens to resistance in series versus in parallel? Series, additive. Parallel, lowers total resistance. And that's pretty much it for our take-home points. See you next time.